Apple's recent launch of its first spatial computer, okay? And we're going to put that in parentheses because Dr. Scheiner is going to be in just a minute, and he'll help us understand the first spatial computer. It has the potential to change the way we interact with each other, connect with our apps, and utilize technology. It's even impacting the future of medicine, believe it or not. Imagine a virtual clinic where patients can access top-tier healthcare from the comfort of their homes despite transportation barriers or mobility issues. With the release of Apple Vision Pro, this fantasy should become reality. Like I said, joining us today is Dr. Adam Scheiner. Dr. Scheiner, welcome to the show. Good to have you with us.
No, thanks for having me.
So the first spatial computer, okay, we hear that and everybody's brain stops for a minute. So I want to make sure they understand what we're talking about so they can appreciate and increase their knowledge for the rest of the information you have to share with us.
Absolutely, yeah. I think what Apple's doing, so there are devices out there, Facebook or Meta has their Oculus, and that has a little bit of the difference between a virtual reality where you put it on and you're in a different world and something called augmented reality where you can see the world, but there's some other digital information kind of floating in space for you. So the Meta has that with their Oculus device, but Apple's is really, really pushing that it's going to be something that's integrated that allows us to see our room and then see other information in the room through these glasses as well.
Yeah, this is incredible, this Apple Vision Pro and how it's going to impact the future of medicine. This has got to be exciting for you to be on the cutting edge of this whole new medical world.
Yeah, I'm a facial plastic surgeon. I do surgery to help people with their faces and help them communicate better with the world. I have a space in this virtual world where I've done virtual seminars. I have my staff connect with patients in a gallery we set up in the Metaverse, and I've actually had meetings with staff from their homes in this Metaverse place that we set up.
Wow, this opens up this whole new world and the power of the metaverse as people are starting to get their minds and brains around this. I mean, you have professionals such as yourself, and even for patients, we've got a little bit of transition to look forward to here, right?
Absolutely. There's a lot of research. Medicine has really been in this quite a bit for the last couple of years. Mm-hmm. They're using it for medical education. They're doing it for medical trials. Virtual consultations, and then they have many, many other applications. They're doing it, for instance, to train residents. They're using this virtual world that goes on the eyes. This is a virtual world where you're totally engaged. They have orthopedics. They're having beginning surgeons practice lifting up the knee, drilling into a knee, this sort of thing, before they ever touch a real patient.
Wow.
And that's really fascinating. Yeah. Augmented reality-wise, there are surgeons that are using this technology to actually perform their surgeries better. There's a surgeon who's in London who is taking twins who are conjoined at the head, where they sort of have one skull with two brains that are connected. Mm-hmm. And he's using augmented reality and virtual reality to plan how to separate these individuals. So it's really impacting medicine in a big way.
Well, as you say, we have been vaguely familiar and have seen robotic surgeries happening. This is all part and parcel of the metaverse, right?
To a certain degree, yeah. The surgeries with DARPA, they were finding ways to do like the Da Vinci system where you can be in one area and control a robot in the other. What's probably coming soon, I just got back. I went to school at the University of Pennsylvania in Philadelphia, and I was actually back there for the 7th annual meeting of virtual reality and medicine. And while I was there, I actually tried a device called haptics. They're actually gloves you put on, and you can actually feel things in the metaverse. That was amazing. And so that will allow us at some point in the future, if we can possibly feel a person's skin 1,000 miles away through these little devices, we could possibly do surgery at some point in the future this way.
Wow. This is amazing. I get to go in for hip replacement surgery the end of next month. And how that's developing I'm here in Florida. I tell my friends, I go, I'm in the hip replacement capital of the world, Florida. And, but the doctors here and the medical, professionals have got this down. I mean, this is like so academic. It's like having a tonsillectomy anymore.
Right, really, really fascinating. Another place that they're using this is with mental health.
Yes, I was just going to ask you. Amazing, yeah.
Yeah, the Metaverse creates a very comforting environment and it helps mental health in general. And they actually did research in England showing that patients with schizophrenia can re-engage society using these virtual environments. And, the mental health crisis we have in the U.S., and we all know that we need therapists, and it's great, but how do we create a response that can scale to meet this demand? The singer Jewel started a company called Inner World that brings group therapy and cognitive behavioral immersion to the masses. And it's also been determined that avatars not being our real selves makes sharing our inner thoughts more easy for people, which helps greatly in therapy.
Well, and we understand that our brains are rather plastic, if you can say that, that there is there is a process. I mean, we've seen this happen, in terms of creating new habits. That there is a way that we can very successfully reprogram our minds and our thinking. I've got to imagine that the mental health treatments in the use of this powerful new opportunity with the metaverse is going to really raise the level and become even more effective along those lines. What do you think?
Yeah, I think so. I mean, what they were showing in England with the schizophrenia, they were really drilling down on where does schizophrenia really go awry. And the issue they have is that in schizophrenics, they hear voices, they might see things or hear things, and those voices get louder and starts to dominate their behavior. What they said is, well, when they stop re-engaging with society, schizophrenics, that's when things go really bad. So let's stop them from getting to that point. So they actually put them in one of these virtual devices. They had AI working with them a little bit, and they said, Johnny, why don't you just open the door and watch people go by your apartment? And they do that for 10 minutes, and then the virtual line would go, yay, Johnny, you did it. And the next day, Johnny, why don't you just actually sit on the stoop and let people go by? Yay, Johnny, you did it. And this is England. They say the next day, Johnny, go down to the pub and just sit there and have a pint and just listen to people talk for a little bit. And in a social environment, the voices are there, but they get damped down because there are other people around there. And then when they take the device off, their brain actually thinks that they did those things. And they say, oh, I can go down to the pub. I can walk on the street. I'll hear the voices, but as long as I'm in a social environment, it's going to be tapped down. That's how they show that it actually helps those patients re-engage with society.
Does this kind of blow you away? I mean, Dr. Scheiner, here you are, you're seeing this, and you're seeing how this evolved. I mean, what is the future for us? I mean, this is moving quite rapidly, so we don't even have to talk about what's going to happen 10 years from now. It's like, what's going to happen in the next 5 years?
Right. I think the devices are going to get much smaller. I think it will be in normal glasses in the future. I think there might even be a contact lens that we wear in the future that allows us to do this. I think the augmented reality, which is kind of interesting, is that idea that, we could meet and I could see something floating above your head, tell me about you, as I'm meeting you, that sort of thing.
Right. Wow. That's going to alter the whole dating experience severely. The kids that are coming up, it's like, yeah, right, exactly. Well, it's it might bring truth back into relationships. We'll have to wait and see. Dr. Scheiner, one last question here about remote surgery and training. We touched on that a little bit. I wonder if you can unpack that a little bit more.
Sure. Well, there's two things. One I mentioned with the orthopedics, they're doing that. They're doing something called using augmented reality now for surgery. So, for instance, for spine surgery, they'll have this device that people put on that will allow them, it's fed radiology scans. Instead of just looking on a screen, they actually beam it on the patient so it's a size relative to where it is. So they look at the skin, let's say the back, and it looks like they're looking through the skin to, let's say, the joints that need realigning, and they can drill exactly where they need to go. It's almost like X-ray vision. Wow. This is it's
absolutely
really fascinating.
Oh man, it's almost like you really can't wait, to be exposed to this. And thank you so much for coming on the show and sharing your knowledge and what you've been able to experience. Dr. Adam Scheiner has been our guest. Dr. Scheiner, where can the people go for more information?
Sure, yeah. If I'm using the Metaverse to communicate with my current upcoming patients, there's a link to the virtual world on my website. If they go to adamscheinermd.com, they can get more information about this really exciting new world.
Well, there it is, Dr. Scheiner. I'll tell you, go into our website.